Now let's return to a story we focused on earlier. The Water Research Commission has today delivered its findings on the cholera outbreak in Hammanskraal. Only one case of cholera in the water was detected. It was near an irrigation system on a tributary of the Arpies River. However, it's not clear if that is actually how the outbreak began. And the Commission says a number of factors contributed to the outbreak. Let's speak now to Dr Jennifer Molwantwa. She's CEO of the Water Research Commission. Doctor, thank you so much for joining us. You know, it's so important what was released today. Lots of important findings, but clearly, from what was said, the people of Hammanskraal are a community at risk. It's the broken and neglected drinking and wastewater infrastructure, and the general environment is just not conducive to health and safety. We can't control the weather, which was mentioned also as a big factor. There was a lot of rain, which made the cholera, you know, it was a thriving environment. But something under our control is how we look after our water, how we purify our drinking water, how we process our sewage. And clearly this community has been failed. Do you believe, as it stands, that this community is still at risk?
Good evening. Yes, thank you very much for the invitation to provide this feedback. And yes, as the Water Research Commission, out of the independent study, we do believe that the community is still at risk, not only of cholera, but of other pathogens that may thrive in the environment where the water that is abstracted for treatment to provide drinking water is at the state that it is at, as found in the Arpies River, as well as the Leeuwkraut Dam. So yes, there is still a very high risk of waterborne diseases in the area.
I mean, that's really troubling, bearing in mind it was the epicenter of the cholera outbreak. Official stats say 47 people died, not all of them in Hammanskraal, it must be said, but most of them. You know, I think today's briefing was startling. At one point, you said if the infrastructure is not fixed, the Arpies River will become a sewer. And just the image of one of our most well-known rivers turning into a sewer, not only potentially lethal for the people who live in the area, but also such damage to our waterways. This must have been very distressing to get this information.
Definitely very distressing. But it's the nature of the value chain of water. We say we are managing water from source, which is from our rivers and our dams, and then to tap, and then back to the source. So it's very much important to understand that the scenario and the context of this area of Hammanskraal, wherein the river wastewater treatment works, it's in fact supplying the river itself with water that downstream gets abstracted for treatment. So the river water treatment works needs to be working optimally, not just it. Every other wastewater treatment works in South Africa has to be working optimally because there are regulated standards for water that is coming out of a treatment works to be discharged into a water resource. And in this case, it's the Arpies River. Remember that it's not only about people that are going to the municipality abstracting water for treatment for drinking purposes. There's people that bathe in the river. There's people that do cultural activities in the river or even religious activities. There's people that abstract and irrigate their crops from this river. So it is, and the biodiversity itself, fish, frogs and other invertebrates that breed in these rivers, the water has to be fit for purpose. That is the critical finding that we found today. And this is not the case in the Arpies River.
Yeah, and as you said earlier, as conditions currently stand, that area is still at risk. And not just for cholera, because your report also said that there is a presence of salmonella bacteria and also I think it's shigella, very, very dangerous diarrhea bacteria. What needs to happen next? And I ask that because I suppose I want to get a sense of whether you've been able to assess if the urgency of this issue has truly been seized. I spoke to epidemiologist Dr. Jo Barnes a little earlier in the program, and she was She was distraught. I mean, she says that it's not just Hammanskraal, there are other areas. We know from the blue and green drop reports, there are other waterways that are absolutely contaminated. I asked her if she believes this incident is the wake-up call. We have seen National Water stepping in here. Do you believe this is the wake-up call? Do you think the wake-up call has been received and we're going to start seeing change?
I want to speak now as a scientist and not out of the report. The business of water service provision in South Africa has to be relooked. Where in cases whereby a wastewater treatment, we are in a reuse, that is a closed loop. In some of the places, it's not the same. But in this case, we're looking at a closed loop. You are discharging into the resource, you are abstracting downstream, you are treating for provision. The mathematics and the science has to make absolute sense. Otherwise, this is a risk of something very bad that could happen. It is important to note that when we looked at all of these systems, they are disconnected, but they are all being managed from the water service provider, that is the municipality. So yes, there is a problem and there is a ticking time bomb. Has the alarms been raised and the priorities be one death is too many? But also the response shouldn't just be like with the water sanitation. It has to be an integrated approach, an intergovernmental approach. It's a disaster and it has to be treated as such.
Absolutely. And we certainly did see that. We saw the mayor of Pretoria, we saw Senzo Mchunu, we saw officials at every level visiting Rooiwal, signalling concern. I think even the president himself was there at one point. Beyond that, are you sure, are you confident that a commitment, an intergovernment commitment to fix this is there?
Until I see the people coming in that space and starting to construct, until I see another model at the water treatment works, Temba water treatment works, until I see another module being put in to treat whatever Temba is treating to a better quality and to put those in that water within the reticulation system for people to have one source of drinking water, I am not convinced. It's not about the money, it's about the action. And this is really what this is telling us.
All right. Well, thank you so much for being so frank with the challenges that we are faced. Dr. Jennifer Molwantwa, she's CEO of the Water Research Commission, but she's saying things have to change and they have to change fast. As it stands, she has just told us that a cholera outbreak could hit Hammanskraal once more